Welcome back, everyone, for training 2 of our Robust Referral System. So today, there are 4 things that we want to do. First, take a look at your referral list so far. We want to see how it's going, check in with one another around it. 2, to identify when a referral is needed and how to respond to a crisis. 3, determine who in your faith community can make referrals and how to keep your list current so that you get the most out of your referral list. And finally, we're going to use some prompts from real life situation to practice making these referrals. So let's get started. Your assignment from training 1 was to develop your referral list. So let's begin this time with a discussion of your progress. What were some of the challenges? Where did you find success? Which part of the referral list still needs work, and how will you tackle it? Pause the video now for this discussion. All right, well, now we're going to begin to talk about how to make a referral. Let's look at this quick reference on mental health, which begins by reminding us that mental illness is common. The brain is a part of the body that experiences illness and fatigue too. So you're very likely to encounter someone who is dealing with some sort of mental illness. Here are a few things that might suggest that someone may need further evaluation or treatment. Related to their cognition, are they confused, disoriented? Are they experiencing memory gaps or answering questions inappropriately? When it comes to their affect or how they're presenting, do they seem sad or depressed, maybe overly spirited, or switching emotions abruptly? Are they speaking too quickly or really slowly, missing words, or are there long pauses in their speech? When you are speaking with this person, how's their logic? Are they having clear thoughts, or are there a lot of disconnected thoughts and maybe some bizarre ideas? And their appearance, are they disheveled or exhibiting poor hygiene, inappropriate attire, trembling, or unable to sit still? These are not definitive signs of mental illness, but may help clue you in to a possible mental illness, especially if these things represent a change from how the person usually presents. Now, when you are speaking with someone who may be presenting signs of mental illness, and it's important to become familiar with these things so that when you recognize, okay, that this may be what we're dealing with, that this person may be experiencing some mental illness, this is how you want to be present with that person in this time. First, express empathy and compassion. Treat them with respect. Listen well, even if things are not making sense. Praise their progress, no matter how small it may seem. And especially if you don't know the person, don't initiate physical contact. Now, if a person is experiencing an urgent mental health concern, if they appear to be in crisis, consider what safety looks like for that person, yourself, and others who are around you. Find a safe place to interact. Consider if there is someone accessible who knows the person really well who can help. Express support. The 988 National Suicide and Crisis Hotline is a great resource for a person in crisis or for you as you try to assist them, especially if you don't have your local crisis numbers handy, right? So even if the person is not necessarily in imminent danger, but you're concerned about them, that hotline will help you identify resources that will allow you to support them in that moment. And then you want to seek immediate attention if a person is in danger to themselves or others. In that situation, call 911 and be sure to request a crisis intervention team, folks who are trained in dealing with these kind of situations. Now below, you'll see some, at the bottom of this, this graphic, you'll see some warning signs of suicide. These warning signs don't necessarily mean that a person is in immediate danger, but it might be good to keep an eye on them. And of course, if you recognize that a person is in imminent danger to themselves or someone else, you want to call 911. All right, so here are some additional resources that could be helpful when you encounter people in a non-life-threatening mental health crisis. So let's take a look at how to navigate them. North Carolina's publicly funded crisis services may be used by anyone, regardless of insurance status or ability to pay. These services are managed by entities or agencies called local management entities or management care organizations, also referred to as LME MCOs. Unless you are in a life-threatening emergency, call your LME MCO's 24-hour hotline number toll-free. The staff answering will help you find the right services for your specific needs. Using this resource that we've given you, you can locate the LME's number in your county. Again, it will list the LME's telephone number, the number for their mobile crisis unit, and also information for their walk-in crisis center. Now, South Carolina has mental health clinics across the state to support people through various services, including individual, group therapy, and family therapy. You can find the clinic for your county by simply clicking on this map and clicking on the county where you reside. Again, if you're dealing with a crisis, you can call the Mobile Crisis Response Team. And again, all these links are available to you in your self-guide. Now, we often have opportunities to offer people support before they enter into crisis. How do you know when to make a referral? The box on the far left gives some guidance. When a person's level of distress is high, too high to manage, or appears to be reaching a point where it will be too high to manage. When a person's ability to make decisions or care for themselves is compromised. And also when there are indicators that a person could be a danger to themselves or others. Of course, if that danger is imminent, you would call 911. Now, take a look at these tips on making a mental health referral. Identify a mental health professional, have a list, right? That's what you've already been working on. That is going to be a huge resource for you. Communicate clearly about the need for referral. You want to communicate to this person that you're making this referral because your skill set cannot handle the level of care that they need. You know, you're making this referral out of concern for them and wanting to help promote their health in every way possible. Make the referral a collaborative process between you and the person and the family. So invite them into that process to offer suggestions, hear things about their needs that might help you refer them to a particular provider versus another one. Reassure that person or family that you will continue to journey with them. Like, you're not just going to refer them out to someone and never talk about this again, that you will be there to support them through it. Be clear about the difference between spiritual support and professional clinical care, and that goes back to communicating the need for referral in the first place. Follow up, stay connected, and support reintegration, and offer other community services and support groups as well. Here's a little more from the American Psychiatric Association's Guide for Faith Leaders. Remember, the link to this guide was listed among the resources from Training Video 1 in your self-guide. So this goes back to a number of the things that were on the previous graphic, but a few things to remember that might help you. To communicate clearly from the start how many pastoral care visits you're willing to provide before the referral. So sometimes people will defer pursuing that referral and just keep coming back to you. And there may be a point at which you have to say, okay, because I can't help you in this particular area, I can't meet that need, I need you to pursue this referral before we continue with pastoral visits. And so you may want to communicate from the beginning how many pastoral care visits you're willing to provide before that person seeks out or follows up on that referral. Reassure the individual and the family that you'll journey through them. We talked about that. Have your referral list nearby for immediate reference. So when you complete this list, make sure you have it printed in your office. Make sure that you have an electronic copy available to you so that you can utilize it when you are not in the office. You want to make sure that it's nearby so that you can reference it. And then you're going to follow up. You can do things like check in to make sure the referral was completed, and just, generally see how that person's doing. You can ask them about, how their therapy is going, how they're connecting with the therapist and things like that. You'll remember in part 1 of the training, we heard from Dr. Armstrong about stigma around mental health, which could lead to some resistance around seeking treatment. So how do you combat that resistance? First of all, you can do it by learning about mental health, which is what you're taking time to do right now. But also, you can learn and help your congregation learn by taking time to address mental health in the congregation in ways that reduce stigma, which might mean talking about mental health in a sermon, or having some weeks or a month for a mental health spotlight in your congregation. Secondly, you want to continue to journey with the person. So checking in to see if they followed up on their referral, to ask how treatment is going, to encourage and support them in any barriers that they might encounter, like maybe financial barriers, or maybe they have barriers around transportation that the congregation may have the means to help with, or you could connect them to another referral that could assist them with the barriers that they are encountering. Number 3, use stories or testimonies of other people of faith who have gone through similar situations. Now, of course, you'll do this while maintaining confidentiality. So you're not going to say, oh, well, this other person in this congregation named such and such was dealing with a similar issue. No, you don't want to say that, but you could just talk generally about someone else you encountered. Or if people are in your congregation, or folks outside of your congregation are open about their journey or their struggles with mental health, you might invite them to come share their testimony during a time when your congregation is spotlighting mental health. Number 4, you can help them engage their faith around treatment. So I'll often encourage a person to pray about finding the right fit for a therapist. There may be scriptures in the Bible that you might suggest someone read to encourage healing through the support of professionals and people who have gifts in this particular area to promote their healing. So there are many things that you can do to help them engage their faith around treatment. A huge part of making the referral is having somewhere to refer people to. That is the whole reason why we're creating our referral list. And in order for that list to be well utilized, you'll have to create some processes in your congregation for using and updating it. So first, you'll need to find ways to delegate the task related to making referrals and keeping the list current. You'll need to determine who in your congregation or on your staff can access the list and is authorized to make referrals, and even what kind of referrals they're authorized to make. Then you'll have to decide who will be responsible for making sure the list is up to date and how and when you'll convene those folks. So pause the video now and take time to discuss and complete worksheet 2, ongoing use. In that worksheet, you can write in the names of people or positions authorized to use the list and make referrals, and determine how the list will be updated. We suggest updating this worksheet every year. All right, well, now it is time to practice. In a moment, you're going to do some role play to practice making a referral. Break up into groups of 2 people each, read the prompt given to you in the self-guide, and decide who will take what role. Spend 3 to 5 minutes playing out the scenario, and then switch roles. In each scenario, there's a role of the person needing support and the faith leader who is providing support. So you'll take 3 to 5 minutes playing out the scenario in one role, then you'll switch roles with your partner and play out the scenario again. Repeat this process with the second prompt, and then reflect on the questions in your self-guide. Well, thank you so much for indulging the role play. It really is helpful to have some practice. And the more you make referrals, the more comfortable you will become and learn how to nuance your approach for each particular situation. Congratulations to you. You have created a valuable resource for supporting your congregation in this robust referral system. Your dedication to this work demonstrates your care for the people you serve. Thank you for engaging this training. I pray that it has been helpful and that the robust referral system will serve you and the members of your congregation and your larger community well into the future.